Hello, I'm Dr. Edmund O'Flaherty. I'm a GP in Dublin, and I have a special interest in nutrient therapy in mental health. I mostly deal with anxiety and depression, and in fact I gave a lecture to the European GP meeting on this subject in Vienna in 2012. Now, our brain is a chemical factory. What we are made up of is vitamins, minerals, essential fatty acids and amino acids. And all day, every day, these chemicals in our brain, which are called neurotransmitters, are being put together from the food we eat. And if we've got too much or too little of certain chemicals, we suffer from mental illness. Most doctors will just give you an antidepressant. They'll perhaps recommend psychotherapy. I will try and dig deep and find out what's causing your depression. Why do you feel so miserable? The old Shakespeare phrase comes to me a lot. How weary, stale, flat and unprofitable seem to me all the use of this world. Many people I see have wonderful assets, wonderful lives you would think, and yet their life is hell on earth. And one woman wrote to me a few months ago and she said, the suicidal thoughts I've had for 40 years have gone. And you know, there is a lot can be added by just using nutrient therapy in association with medication, and using as little medication as possible. Then get less side effects, people feel better, they don't have the side effects of these drugs, and of course it's much more socially acceptable to say I'm taking zinc, I'm taking fish oil, I'm taking magnesium, instead of saying I'm taking Prozac. So I will take blood samples, a urine sample, and I will have them analysed very often by a specialised lab in London like BioLab. And when I get the results, I can very often say, I think the cause of the trouble is this. For example, high copper, low zinc. There are two of the big ones I come across. There are other more specific and more elaborate tests I do as well. What we do then is we try to find out what's causing the chemical disturbance that makes anxiety or depression, and we do what we can to remedy that. Whether it's too much or too little, we bring it in towards the normal level. We bring the zinc up near the top of the normal level, and because it just seems the brain functions a little bit better if it goes towards the top of the range. And antioxidants are widely used, and we find that long term they're good for the brain as well, because our brain is a very active part of our body, and we like to conserve the brain tissue for a long, long life, and hopefully a long and healthy and happy life. Thank you very much.